hepatitis C. So as you can see here on this slide, hepatitis C affects about 3 million people in the United States, HIV a little over 1 million, and there's this area of overlapping which involves about 150 or 300,000 people who we say are co-infected, have both HIV and hepatitis C. So because of this, the study of hepatitis C has been very important for the care of our patients living with HIV. And some of you are too young, some of you are old enough, but remember back in the 1990s when there was a flurry of new therapies for HIV that revolutionized the management of HIV, led to a 90% reduction in death rates really in a couple-year period and so on. Well, what's happening in hepatitis C is the rapid development of medications to fight hepatitis C, and many of these are molecules that really come out of the HIV research field. These medications that are used for hepatitis C are not active against HIV, and our HIV medications are not active, but the concepts are similar. So for example, there are protease inhibitors for hepatitis C, just like there are protease inhibitors for HIV. There are polymerase inhibitors for hepatitis C, and drugs that we have like AZT and tenofovir and so on are polymerase inhibitors as well. We use the special term reverse transcriptase inhibitors, but they're also in this family. But this is just a slide to show you how many different medications were studied at CROI. Oh, thank you. It's already useful. One of the hottest drugs, which is one of the most recently licensed drugs, is a drug called sofosbuvir. Have anyone heard of sofosbuvir? Yeah, so this is one of 2 new hepatitis C agents that come out in the last 6 months, and it is a nucleotide polymerase inhibitor for hepatitis C. And I want to just show you in 2 studies the benefits of these new agents. This is a study called PHOTON-1, and it's actually among co-infected people, so people that have HIV and hepatitis C with different strains of hepatitis C, genotype 1, 2, or 3. And this sofosbuvir, which is given once a day, plus another oral pill or collection of pills called ribavirin, and was given for either 12 weeks or 24 weeks. And these are the data that are presented. So let me introduce a term here. So we use a term called SVR, which stands for Sustained Virologic Response. And the term SVR12 means a sustained virologic response 12 weeks after stopping therapy. So similar to how you monitor your own HIV infection with a viral load, we use a viral load for hepatitis C as well. And before people start therapy with hepatitis C drugs, the viral load is often in the millions. It comes down very rapidly. It becomes undetectable during the course of therapy. And then if we're successful, once we stop the hepatitis C medications, the virus doesn't come back. And we use the term sustained virologic response, but it really means that the hepatitis C is cured. So in contrast to HIV, where we're doing a very good job of keeping the virus under control for the rest of a person's life, hepatitis C, these drugs offer the prospect of cure. So these are a series of patient groups with different strains, and whether they're naive to treatment or experienced, and you can just see here the rates of cure over 90% for this group, maybe down to 60 or 70%. And this is with oral pills given for 12 to 24 weeks.
Wow. Yes.
And I'll end with the most kind of exciting study that was presented at CROI in terms of hepatitis C. And this was a trial among people with hepatitis C that don't have HIV. But before I go into this trial, I want to mention that one of the findings from recent studies is that people living with HIV who have hepatitis C do just as well with these hepatitis C drugs as people that have hepatitis C without HIV. In fact, there's a couple studies that show that HIV patients do better, probably because you're enrolling HIV patients who are already used to taking medications, have an undetectable HIV viral load. So this was actually a small study. I believe it was at the NIH. It involved 60 patients with hepatitis C, and these were the study drugs. There's a drug called Lodipisphere, which may be licensed this fall. A drug, sofosbuvir, which is a licensed drug, and then these two drugs that are early enough that they just have letters and numbers. But you can see here that these are different types of medications. And here's the results. So I'm presenting again the cure rate for hepatitis C. So here is 12 weeks of Lodipisphere and sofosbuvir, 20 out of 20 were cured. Here's 6 weeks of a 3-drug combination, 95% were cured. And then here's another 3-drug combination, 100% were cured. And so what's happening in hepatitis C is the medications are getting safer and safer and easier, and we're giving them for less and less amounts of time. And so the olden days where we were using interferon shots and ribavirin and so on are quickly being replaced with a treatment approach that's very similar to how we treat HIV, with the important difference that we'll be able to give it for a period of time and cure hepatitis C.
Wow. All right.
You mentioned the cost?
So these are costly. The one sofosbuvir is about $1,000 a pill. But the cure of hepatitis C is very likely going to lead to a downturn in the risks of liver disease, liver transplants, death from liver cancer, and so on. So just like HIV drugs are expensive, but they prevent expensive complications, I think the same thing is true of hepatitis C. And here's just a list of some of the drugs and where they are in the pipeline. I don't really need to mention that, but this is a very rapidly growing field. If you have hepatitis C and it's active, you ought to get in to see your physician or nurse practitioner and so on and talk about some of these new therapies. There also are clinical trials